Hey guys, Andrew Dowling here and Mitch Kurtz. Thanks for joining us for another episode of the AltMed podcast. Make sure to hit like and subscribe because we've got heaps more content coming out and it's really fun and great and we love it all. Also very good.
Hey guys, welcome back to another episode of the AltMed podcast. My name is Andrew Dowling. My co-host is with me as always, Mitch Kurtz. And Mitch, how are we doing?
We're doing very well, thank you, actually.
Yeah, you're looking good. Now, we've got a situation. You're in Melbourne, I'm in Adelaide, and our guest is in Perth. So we kind of got the continent covered on today's potty, but we have none other than Dr. David Turton from Medicann Clinics. David, welcome to the show.
Hey, Andrew, and good day, Mitch. Thanks for having me. It's a pleasure to be chatting to you guys from Perth.
Great to have you on. We love the work that you and the crew do at Medicann Clinics, but maybe we'll kick things off. Can you talk to us about your humble beginnings and how you became a cannabis doctor?
Yeah, absolutely. Thanks for the question. Just a little disclaimer before I start. I always like to say that this information within the podcast is for general information purposes only. And if you've got health issues, please see your own health practitioner. Don't listen to a random guy and decide to stop all your medicines. So I really fell into cannabis. I was working in general practice before that here in Perth in the metro area. And I suppose prior to that, I'd had some ideas around alternative and complementary medicine and had worked through the hospital system and then kind of went into general practice, quite idealistic and I suppose wanting to really affect a lot of change in people's life and change their habits and get people really improving their healthcare. And I felt a bit limited in general practice. I felt that there was an enormous burden of chronic disease, which we see sort of worldwide, but also reflected here in Australia. And I felt that I didn't have an awful lot of time in general practice, wasn't sort of having those meaningful conversations around lifestyle change and different interventions, and then kind of naturally migrated out of general practice and found myself in medicinal cannabis.
So I'm just curious about the part, I suppose, when we talk to doctors and not just cannabis prescribers, but just talk me through that. So you finish med school and you probably have this idea when you specialize in GP, which, you know, as many of our listeners would know, is its own specialization. Is the thinking when you go into that field that, hey, I'm going to get to be a generalist, I'm going to get to see lots of different people with different illnesses, and I want to play a role in helping them. I'm interested in your perceptions of how, you know, the current system that we're in kind of compels doctors to really churn and burn through patient load, and whether or not it allows you, you know, the time to really get to know a patient and understand their health.
Yeah, absolutely. So you're absolutely right. So you move from medical school through various kind of years within the tertiary hospital system. So you're working in big hospitals before you move on to a specialty, be it general practice as its own specialty or a surgical specialty or whatever it may be. Certainly for me, moving into GP, there are kind of constraints on what I felt you're kind of capable of doing in general practice. One of those being time. Certainly, the consults are short. The challenges and the health concerns are complex. And then, at least for me, the kind of model, there's a few issues with the model. Without, you know, giving Big Pharma a bashing, there really is a pharmaceutical model that's kind of been bred into the education of doctors and I guess nurses and health professionals generally, and that's reflected in general practice. And I guess I had created an idea around the ideas of health and well-being, which really centered around helping people to improve their nutrition, helping them to manage their stress, move their bodies, sleep well, do what they love, the real fundamentals of health, as I call them. And I felt that they were kind of neglected within general practice, not through some sinister plot, but simply to do with a lack of time or difficulty trying to inspire and educate people to empower themselves with their health rather than just end up stuffing tablets into their mouth, for want of a better explanation.
Well, this is something that we've talked about with a few doctors regarding kind of a more holistic approach to health, but it also crosses over with, I guess, some of the traditional education that doctors do or don't receive. For example, we've talked about doctors not learning about the endocannabinoid system in medicine school as a starting point, and how introducing new medication or new systems like that usually have, is it from memory, a 17-year arc? Is that right, Andrew? Is that?
Yeah, somebody described that. So anytime new medical knowledge
I think it was Zaina.
or it can take, a couple of decades, say approximately, before it's adopted well and truly into mainstream education.
Which, by the way, makes cannabis so interesting, because you'd imagine that any new medicines that have been introduced have not had the uptake that cannabis has had in the special access scheme, or maybe I'm wrong. Maybe you've seen things that we haven't, Dr. David. But yeah, what's your take on all that?
No, I think you're spot on, and I think that's about right. There's normally like 1 to 2 decade lag time as far as a new concept or thing that is uptaken and becomes kind of widely accepted. I guess it's interesting with cannabis because it has such a history of being so heavily used in earlier centuries and was a mainstream medicine, at the end of the 1800s and early 1900s. It existed as a totally mainstream medicine. And we know that things have obviously evolved with prohibition and the way that cannabis has changed and now kind of made a resurgence. But doctors aren't taught about the endocannabinoid system at all. I didn't know. I came through 15, 16 years of education before even hearing about it. I mean, it would be like omitting the endocrine system or the hypothalamic pituitary axis or the main hormonal system. So it's definitely not being taught. It's definitely something niche that people are starting to uptake. I suppose the positive thing there is it's becoming hard to avoid now. GPs are starting to see so many more patients that are coming in and asking for CBD medicines or THC medicines for their range of ailments. So it's kind of in your face now. And I think general practice and other specialties are going to have to start to look at it and I suppose look at the evidence and start to evaluate what is there rather than just dismissing it, which sadly is part of the story that you still hear for a lot of patients. Go to see their primary care doctor and say, look, I've got chronic pain or this chronic problem. I've tried loads and loads of different therapies. What can you tell me about cannabis? And then we do still hear of people being told, look, get out of here. That's nonsense. Or, we don't do that, or still carries that stigma somewhat.
Yeah, it's interesting. Something I often think about is, you're talking about cannabis, whether or not you've considered it a medicine until more recent. It's always had a kind of, it's been talked about as a therapeutic agent long before modern medicine. So we know, and we've many different herbs and ailments have been talked about in, I don't want to say prehistoric's not the word, but like say medieval times, and things of that nature. But one thing I've always thought is that anything that has a psychedelic effect or let's say an intoxicating effect, any compound that can have that type of, I don't know, transcendental experience or that kind of altered state of reality, it to me, it indicates, and this is my assumption, not being a medical professional, but it indicates kind of where there's smoke, there's fire. It has the ability to have that type of effect on somebody. So potentially there are, even some of the banned medication or Schedule 9s and 10s can have both negative but also potentially therapeutic applications in certain ways, whether or not they do long-term harm or they cause carcinogenic reactions for, say, some of the more Schedule 10 ones. I've always thought that way about cannabis. Like there's something that can create that effect must have applications beyond just the intoxication, if that makes sense. I'm not sure if that's a very educated view to hold, but it's something that I've thought. And curious to get your take on that.
Yeah, I think that's interesting. The first thing that kind of popped into my mind is that there are various pharmaceutical medicines that, not to say that they are psychedelic, but certainly psychoactive. There's loads and loads of prescription meds that will do all kinds of things to your mind, be it benzodiazepines or
Yeah.
still knocks and sleeping tablets or opiates, all kind of things, not to that psychedelic nature. But I think what you're kind of leaning into kind of lines up with nicely with the resurgence of ideas around plant medicines and different things that are being used with a practical application within medicine, whether it's the LSD and psilocybin from magic mushrooms or MDMA are sort of three areas that you guys would obviously know there's a lot of talk about now being explored for therapeutic role. For example, in like people that have terminal illnesses that are dealing with, impending death, and being able to help people to transcend and experience through a single or a small number of multiple guided experience with a trained therapist in a clinical setting. So I don't know if that answered the question that you've asked, but I think definitely.
No, I take your point.
Yeah,
Yeah.
it's almost like and what I also got from what you were saying, Mitch, is that I think cannabis is almost a bit of a test for everyone, because it's, we're sort of looking at this thing that's symbolic of potentially other substances that we are overlooking their therapeutic application.
Yeah.
And it's almost like a test case, really. I just had a question, and you mentioned before, David, that you don't want to bash Big Pharma. I just want you to know that AltMed has since day one been a very safe space to bash Big Pharma. So totally fine to do that on this podcast.
We bash everyone, actually.
We do. We don't discriminate with the bashing, but we don't really bash Little Pharma, if that's a thing. But
I guess I have a funny take on this, and it's probably going to be wholly unpopular, but
safe space.
I've moved from very much a conventional education and training where I was very caught up in pharmaceuticals and that line of thinking, and moved into, let's say, a more rounded, holistic perspective, for want of better description, and definitely went through a period where I was bashing Big Pharma and, not really being grateful for those medicines that are life-sustaining, that help people. So there's as much good as there is bad within Big Pharma. But then I also bring it back to a personal autonomy, responsibility argument, which is like, if you want, Coca-Cola are a business, right? And they're going to make this sugary drink that is awful for people's health. If people drink that, and so many people are drinking it, it sends a very strong message back to Coca-Cola, please making Coca-Cola. If people say, we're not going to drink that, we're going to veto that crap, and we want water, Coca-Cola are going to move into producing water, which they do, or various other drinks. So I see that same responsibility argument with medicine. If we can all choose to try and avoid as many medicines as we can, and try not to put them in our mouths and live in a way that keeps us away from them, then it sends a clear message saying, we don't want your tablets unless we absolutely need them.
In saying that, after spending a couple of nights in the ED a couple of weeks ago, some of these chronic pain medications, which are very Big Pharma, I don't want to say chronic pain, but in my case, acute pain. Yeah, it was. I was very happy to receive that. Now, I only took it for one dose, or maybe a couple of days. I wasn't taking it because I didn't have a chronic condition. But in that scenario, it made complete sense to me, and it definitely did do the job.
And this is the thing. I think it's easy to roll everything up into a ball and talk generally about it. When you have an acute problem, if I have kidney stones or, biliary stones, and I'm in agonizing pain, give me the morphine, right?
What about the Mighty Medic in that situation? I mean, why aren't they passing around the Mighty Medic in ED is my question.
Let the doctor answer that one.
Sorry, yeah. By the way, if ever there was evidence required of why I'm not a medical practitioner, that was it. But over to you, David. Sorry, I interrupted.
I'd like to see a greater uptake of cannabis medicines for people for pain and a whole range of other syndromes, because I think it's really safe medicine if it's done well. If it's done with guidance, I think it's extraordinarily safe. I think it has great efficacy for many, many people, and I'd like to see it used for more things. I don't think opiates are a good solution for chronic pain. I don't think anybody does. There's got to be solutions that have less side effects and have less of an effect on your ability to function, that are safer.
It's also really hard to get morphine in the mighty Medicann, just so you know.
I've tried and I agree with you. So
Is there a section for do they take oils as well or liquids? I thought they would just dry herb.
Oh, that one, yeah. But I think there are other ones that do take oils and liquids. So
no,
yeah, who knows? Oh, you just put the flour in an IV drip straight through.
Mainline straight in. A question before we jump, because I know, yeah, you and you've touched on the interest that you have in holistic, your holistic approach to treating your patients, and I do want to get to that. But before we leave the realm of just the way that doctors are currently entering the workforce now and the education that they receive, I know that with certain doctors who have been very skeptical about cannabis medicine, what they have to say about it, I think, reflects the training. And this is just something I want to kind of get your take on, but they will say, there hasn't been phase 3 randomized control trials. I need to see basically an article in the New England Journal of Medicine or the Lancet or something that tells me that, I can treat this condition at this dose in this way. Is that type of, basically that is what am I trying to say? Does med school teach you that is the be all and end all as far as, the gold standard of evidence that doctors should be looking to? Because I think where cannabis has really entered the scene is that, okay, that in the absence of that level of evidence, which by the way requires millions and millions of dollars, sometimes, nearly closer to billions of dollars, people are talking about it anecdotally. And does anecdotal evidence from a patient about how a particular medicine helps them stack up or merit any mention in med school?
That's a long question. I think anecdotal evidence and clinician experience is incredibly important. We're definitely trained within medicine to be trained skeptics and to question everything and to come at things with a kind of know until proven otherwise way of looking at things, which is certainly beneficial and is a nice way to try and cut away things that are going to be potentially harmful. I think that probably emanates out of the history of medicine and different treatments and, the snake oil salesman trying to differentiate between what's going to be helpful for a patient and what's not. So the randomized control trial, the meta-analyses, the sort of gold standard. Treatments aren't going to get to that level of testing if there's stigma and unwillingness or lack of finance backing it in order to explore it. So it's kind of double-edged. That's what we're looking for, but a lot of medicines aren't given the chance to get there because they don't have they don't fit the model, let's say.
Yeah.
So
and also just the ability for big pharma, as I said, safe space to bash big pharma. We know that certain approved substances, particularly in the last, say, 50 years, have actually proved to be harmful and have been withdrawn despite going through the pre-marketing approval processes with any country's given regulatory agency. I mean, I look at that and I say, well, that's a symptom that data can obviously be manipulated. And I agree with you. Of course, we want to avoid snake oil being sold to people, but there is also clear abuse of that gold standard in some instances. And yeah, it's that to me concerns me.
100%. I think we've really played down the importance of clinician experience and anecdotal evidence to the fact where people are clinging to this idea that the randomized control trial of the meta-analyses is the only thing. If you don't have it, then you may as well just bloody go pack up and go home, boys, because there's nothing else going on. But if you've treated 1,000 or 5,000 or 10,000 patients with a therapy, and you've got your eyes open and you see the data coming back, but you're seeing people get a wonderful benefit from a range of things, then that carries a lot of weight as far as I'm concerned.
Agree.
How many examples of that could you talk about, out of curiosity?
Of patients that have had great benefit from cannabis?
Well, I mean, cannabis, but even other, things that you've seen in your clinical practice where, maybe it doesn't have every single piece of clinical data that you would ideally like to see as a conservative GP, let's say.
The one thing I was going to say there is there's a lot of medicines that are used off-label by doctors, and to me that really says we haven't tested this, we haven't got data to show that this works, but we've had a few people come back and say we were giving this antidepressant to you for depression, but a lot of people coming back saying it's great for sleep. To me, off-label use is analogous to anecdotal evidence. So loads and loads of medicines are used off-label within medicine.
Yeah.
And, you can go down and chase RCTs on all of those, or you can just accept that they work. So
yeah, and isn't it the case that in some instances, a medicine will be approved, say, for PBS funding and subsidization for certain conditions, and a doctor might know that, well, okay, it's approved for this type of arthritis, but there's another type of arthritis that I could treat with this drug off-label, but they have to, that then forces bad practice, because the doctor, in order to have their patient, get the PBS benefit, has to then effectively diagnose the patient under the medical condition to which the PBS benefit attaches. So
yeah. Sorry, go on. That's
right.
100%.
I'm sort of just again highlighting these structural deficiencies, which I just think haven't yet been overcome.
100%. I don't know the ins and outs of that kind of quagmire of billing and how that sort of side of things work, but definitely, there are indications where it's listed and the patient will receive support for concession for that particular indication, but not for something else. So I think that adds more complexity as well.
Indeed.
Yeah, and I think we see this, in spades in cannabis as well. There's a lot of times where people say, or at least what we've heard anecdotally, that somebody will start it for X condition, or the pain, for example, and they say, oh, by the way, I got a really good sleep, or I wasn't feeling as anxious, or my period wasn't as bad this month, pains, so or something like that. We hear this kind of thing all the time. Is that something that you would agree with in your own kind of clinical observations?
Yeah, absolutely. A nice one I had was a chap that was about 60, and we started it for chronic shoulder pain or something like this, and he'd had a tremor his whole life since he was about 5 years old. He described a benign essential tremor where his hand would move, and started him on CBD, and he came back and said that tremor, which has been there for 50, 60, whatever years, has gone.
That's amazing.
I had an obscure one recently. A woman's taste came back, or one of her senses was heightened with CBD. I think there's people coming back saying all kinds of things, which to me just reflects the widespread distribution of the CB2 receptor and the how important the endocannabinoid system is in so many organ systems and vital functions. So I think that's really common to have people come back with a range of things that have benefited.
And like just the fact that we don't know how that's even happening, or like maybe some people do who are, researching and at the forefront. But I have previously described on our show that, human beings as complex biological systems interact with cannabis medicine, which in itself can, particularly if it's not an isolate product, it's a full spectrum oil, or a flower can also be considered perhaps a complex biological system, and the interaction between the two is certainly, when it throws up outcomes like that, it just tells us that we have so much in front of us to discover.
Yep, absolutely. Couldn't agree more.
Yeah. Sorry, just while I was ranting earlier, one other thought came to me. Do you remember in the just in the midst of COVID, I think we had this idea that you could get a bulk billing for you could bulk bill telehealth consults if you had previously seen the patient in the last 12 months, but there was situations where you hadn't seen patients because of COVID lockdowns and that sort of thing. Do you feel as a GP, and given the lessons that we learned about how health delivery in many instances, particularly when a patient, say, has COVID or has the flu, is safest to be delivered via an online telehealth consult, do you think that is your preference, or do you still prefer to see patients personally? Do you think that people, and sorry, just as an addendum to that, do you think GPs should be able to claim bulk bill over online telehealth?
Gosh, that's complex.
Yeah. We're just hitting you with all the structural questions today.
I think telehealth has been incredibly helpful through this period that we've been through, and I think it's changing medicine. Video conferencing and ability to see people with, in different places, and a great example would be being able to see people in remote areas, provided that they have, phone signal or an internet connection for video conferencing. I think it's good and bad. I think it has some drawbacks. We're losing particularly if you're not video conferencing with face-to-face, we're losing the visual sense and ability to physically examine someone. So I think it plays a role for certain things, and there's lots of doctors using telehealth in different departments, let's say, like integrative medicine and other areas. But I think you also lose the ability to examine the patient and to get that critical information that you can get when you physically, face-to-face and touching somebody.
Yeah.
As for the bulk billing element of that, I don't know.
Yeah, sorry. And yeah, it's you're getting plenty of loaded questions from me today, so apologies for that. Let's jump to your holistic practice. So before we jumped on the potty, we had a brief chat beforehand, and you're talking about how meditation and breathing feature as part of some of your practice. So can you talk to us a little bit about that?
Yeah, 100%. So it's my assertion and my, fundamental belief that what's killing people now and what's carrying the burden of disease in our country and globally is chronic disease, problems that are around for a longer period of time. And I know you guys love genetics, at least within, cannabis. I'm going to go and say that with loads and loads of medical problems, genetics has a small role to play. And I think it's a general misunderstanding in the community that our problems are inherited and they're genetic, which there is a genetic component to lots of things. And there are some single gene mutations where genes are incredibly important, but they make up a tiny fragment of the diseases that we see. Far and above what's carrying the burden of disease is lifestyle disease. It's people killing themselves through the way that we live, myself included, and that's through the choices that we make every day and the way that we choose to live our life. So my point of view is coming at things in a way to try and help people to modify the way that they live and their daily behaviors that are contributing to the development of these syndromes and diseases. I think there's lots of information out there, and everybody has a fair idea about how to live a healthy life. So the question is, why is it not happening? And I think it's a problem with implementation and execution, where people are busy, they're time poor, they've got kids, they've got a busy family, and the things that are life-sustaining things, which you mentioned two of them, meditation and breathing, they're being neglected or not being taught, or people aren't aware of the importance of them, or won't make time for them. So I try to move away from quick fix medicine and into, which is terribly unpopular, like I've got to say, it probably
but you're a doctor, you're meant to just write scripts for people in a 5-minute consult, and that's your job, right? That's it.
Well, this is the thing. Like I
So I did say
for a
loaded
while
question.
I was really dismayed for a while when I went into general practice, and I have started to think that it's not general practice that's the problem. It's me and the way that I look at it. I see the role of a doctor to be someone to help coach people and to teach people and to educate them, not to be technicians and diagnosticians and just simply order tests and then flick off quick fix solutions, but to actually teach people the fundamentals of health and well-being. So that's what I'm using within alongside medicinal cannabis. I think cannabis is a great way to, and don't get me wrong, I love it as a treatment, but it's a great way to get my foot in the door with a whole cohort of people that may or may not be open to trying different things. But when you have plenty of time with them and you get a chance to chat to people about other therapies that might go hand in hand with cannabis, I think it's powerful.
Yeah, well, I mean, in terms of like, say, for example, achieving a state of calm, say somebody who, suffers from a sleep disorder, I've definitely heard people tell me that they find solace in just engaging in really deep, considered breathing, to achieve calm before bed. And I can imagine that going hand in hand with, with a cannabis treatment as well. Is that something so far-fetched as an idea?
Absolutely not. It's something that I like to incorporate into practice. To me, having a nocturnal breath practice is incredibly important, and it's something that I use every night myself to switch off that fight or flight nervous system and move into that parasympathetic nervous system, which people will be familiar with, is about resting, digesting, and really allowing the body to relax before going to sleep. And that's really just summarized by long, slow, deep breathing. There's no sort of magic to it. I like to encourage patients that might not have considered breathing alongside, particularly those that are using flower, for example, for assistance with sleep, to try and work a breath practice alongside their inhalation through their vape of their cannabis as a way to, whether you do it 5 minutes of breathing before having the inhalation and then 5 minutes after. But we know that you can augment the way that you absorb cannabis by having good ventilation. So if people are taking tiny little bird breaths from the top of their lungs and not ventilating, to get somebody to learn how to breathe from their belly and their diaphragm, like the yogis and the ancient teachers teach, and then work that in with cannabis, I think it's wonderful.
I love it. It's yeah, I'm on board with this. I haven't personally tried that approach just before bed, but I imagine it would result in a very good night's sleep. But it just in terms of lifestyle factors, I know we could probably, pick a whole range, but sleep hygiene, sugar intake, like what is it that when you see a patient, what kind of information are you pressing for? What are the data points that are going to tell you a little bit more about how a person's lifestyle might be affecting them? In my case, by the way, I barrack for Essendon, and I can tell that this has an adverse impact on my mental health. But look, it's my choice.
But good supplements though.
Yeah, cheeky.
What was that?
Mitch had a go at Essendon about the supplement saga. Anyway, just couldn't keep that one to yourself.
I like to sort of flesh out with people and see where they're at. It's not for me to tell anybody how to live their life, but I know the things that I've adopted myself in the last 5 years, which is really when my own personal kind of health journey began and things changed. And I started, really looking into alternative and complementary and a whole broad range of other healing modalities. So it depends where somebody is at, and nobody wants someone to jump on the phone with them and start talking cannabis and then say, do this, you need to do this. But I think people want what's best for them. And often people bring it up, they're like, my sleep is a real problem. So if we're talking about sleep, I said I wasn't going to talk about booze, but I will try and get people to quit booze, quit caffeine, the general sleep hygiene principles, getting off screens, managing stress throughout the day. I think a daily meditation and daily breath practice, even if it's 5 minutes each, is incredibly powerful. And I think you can't argue with the science and the research behind meditation and breathing as a way for improving health outcomes. There's stacks and stacks of literature on it. I'd love to find a way to, and look, these things are opening up massively. What used to be sitting in a cave in the Himalayas for the aesthetic, or, somebody that's given away all their possessions and chosen that monk life, is now loads of people. You've got tradies meditating. I just get blown away when I hear, people come back and say, yeah, I'm doing a daily meditation before I start shoveling concrete. I'm like, that's amazing.
This is not code for smoko. This is a tradie on site heading into a yogi cave and having a stay.
Yeah, you can imagine them coming off site and just being, sorry, mate, just going for a yoga.
I love it. I actually really rate that.
Yeah, I'm actually curious, considering this is AltMed and it's not just Cannamed, I'm very curious around a little bit of the science behind the breath work and meditation. You don't have to go too deep into it, but at just a high level, what's kind of occurring, the physiology of in those experiences, and very curious.
So as I kind of touched on with the breath, when you take an inhalation, you're probably aware that your heartbeat beats faster, and then when you exhale, things slow down. There's a reason for that, and it's to do with the way that your breath is linked to sets of nerves, one of which is called the vagus nerve. Basically, when you exhale and you slow down your breathing, you're activating a nerve that goes to your heart and to your other organs, telling it to slow down, telling it to calm down. So it's really that slow, prolonged exhalation phase of breath that is helpful in causing a state of relaxation, I guess, is probably me trying to explain it simply and failing.
No, it's really interesting. Is it also like, I've found that when, for example, even just, like immediately after a run and your heart rate's up, you're taking quick breaths to get oxygen in. When you kind of override the system, which is just going to slowly come to a deeper and more measured breathing, if you really slow it down, and maybe you've got a view that this is a terrible idea, but sometimes when I finished intensive exercise, I will actually force that deep breathing. I just find everything just fast tracks in terms of the recovery and just returning to normal again.
100%. People have been changing the way that they augment their breath for health benefits, but also for sort of strange transcendental experience as well. And something super popular at the moment is Wim Hof breathing, which is really just a redo of all these sort of ancient, more traditional ways of breathing that's been slightly modified. I don't think there's a right or a wrong answer with breathing. I think it's the sort of thing that you can have a relationship with if you're interested, and start to explore it and try, fast breathing, try slow breathing, as long as you're not driving a vehicle or underwater, which would be hard. Doing it in a safe space. There's so many different ways to learn to modify your breath to improve your health outcomes. And they know that things like people can bring down their blood pressure through meditation and breathing. People can reduce their heart rate, increase heart rate variability, which is the time between beat to beat, which is a marker of sort of overall cardiovascular health. Relaxation, assistance with sleep, mental health benefits, calming anxiety. There's a huge list of potential benefits from these things. I think one of the barriers to uptake is the fact that, well, maybe two things. People are like, that's too simple, that's stupid, particularly with breathing. Like, why am I going to do that? That sounds dumb. And maybe for meditation and breathing, getting into a habit of working it in as a daily practice and making the time to do that. I just have somebody's car alarm going off. I hope you can still hear me.
No, we got you loud and clear. Sounds like we got a bit of a special guest getting a bit vocal in the background. We love that. We've had a few guest pets actually just make a cameo appearance on the podcast. over the years. Well, look, no, David, we know you're a busy man, and we'll wrap it up there. But just want to say a huge thank you. I think we've really touched on some interesting points out of this discussion. You lending your experience and what your approach is to health, and how you square that with the way that you were kind of brought into the medical profession, and your observations around breathing and meditation being able to play an important role in someone's just general well-being has been great. So really appreciate you taking the time to come on and chat with us.
No, it's a real pleasure to be able to come on and say something. And we talked a bit about cannabis, and we talked a lot about alternative, complementary, and holistic healing, which is definitely my jam. But alongside cannabis, and it's all powerful stuff. So thanks for the opportunity to come on. Thanks, Mitch. Thanks, Andrew. It's a pleasure.
Yeah,
thanks, David.
I should say as well, just as a final comment, appreciate the disclaimer at the start. Feel like my thunder was stolen a little bit because I'm meant to be the lawyer, but no, appreciate you getting that one in there. And yes, as David said, this is general information. So,
and thanks to all the team at Medicann Clinics that you work with. We've obviously had a few of the crew on the show before, and it's always great to see
Jenny, big fans. So sending good vibes over to you guys out west.
Yeah, they're a great team.
Awesome. All right, David, take care till next time.
Thanks, guys. Cheers.
Hey guys, Andrew Dowling here, Mitch Kurtz, and thanks for joining us for another episode of the AltMed podcast. Make sure to hit like and subscribe to stay up to date with all that we have coming. All things AltMed? Yeah, that too. Okay.